All right, we are recording. I always get the name wrong, so Melissa, why don't you introduce us?
Oh, I am just so excited to be back with another episode of Hope, Power, and Healthcare. And just like you, Chris, sometimes I do wonder if we should replace the power with something else that starts with an H, and then we could be H3 or something clever like that. But I'm Melissa Riley. I'm joined by the fabulous and amazing Ann Somers Hogg.
I thought that was the opening for Chris.
It was supposed to be. He totally missed his cue in. Go ahead.
Oh,
Chris.
I
okay.
intentionally missed that. I want to throw that to somebody more deserving.
I'm joined by the fabulous and amazing Chris Hemphill, who's supposed to introduce himself. And we have a special guest today.
My name's Ann Somers Hogg, and I am thrilled to be here chatting with you, Chris and Melissa. I work at the Clayton Christensen Institute, which if folks aren't familiar with it, it's a think tank dedicated to improving the world through innovation. And I lead our healthcare research, which is how I got connected to Chris.
Thank you so much for joining us. What we're aspiring, and y'all, if you've been listening, we started in June of 2025, and we're still figuring out who we want to be. Like the first episode, don't gatekeep yourselves. We didn't have all our equipment or anything like that. We said, let's get started anyway. But we're getting, like, as we listen more to the fam and what you like about these episodes and things like that, Melissa, I'm speaking up. You tell me what you think about this. And Alyssa, our producer, I wish she could chime in as well. But ultimately, daily fuel, not just the podcast concept, but daily fuel for people that are innovating in healthcare. It's hard out there. There's all kinds of complexities and different things like that going on. So when we look at these different perspectives, like we've had guests who have founded companies or have been operators within large spaces, we're just trying to get that that thread of innovation across all these different groups. And we want to do this on a daily basis. Like we want to have something to put out every day for folks. Well, how do you feel about that?
I mean, I think our thesis really is refining itself around innovation. And when I look at the pace of change that's just happening in the world today, I think there's so many interesting sides and shapes to this innovation. There is like, what will your career look like as this innovation happens? There's who are you? We've talked a lot about identities, right? Through innovation and in the ecosystem, oftentimes like people stay in their silos. And so I think we're also silo breakers, Chris, where we try to say, hey, you used to be a payer, Melissa, and now you're a startup coach. Or Chris, you used to be a data science, you're still a data scientist, but now you're doing it sometimes inside a new ecosystem. How does the world change for you?
Tremendously. The time from April to now has been like some of the most vast change from a career and life perspective. It's been a roller coaster, and I've been glad to have people on because I wanted to talk about, like, hey, at the very beginning, I didn't position or negotiate some deals correctly in this journey. And, if I'm vocal about that, then that'll protect other people. So, there's been a lot of fun in that. And Ann, you have a super cool story. Ann Somers, I'm sorry. Super cool story about how you found the Clayton Christensen Institute. We're really excited to like, if we're talking about innovation all the time, what if we bring one of the leading institutions developing innovation models for healthcare? Let's just, what's your relationship? How did you even find a position there?
Love that question. So I feel like, as most people would say when they talk about their career, well, that's not really what I expected the next step to be. So I started my career in strategy consulting, actually on the payer side of healthcare. And then I went to grad school, and then I ended up working for a health system, Atrium Health, now Advocate Health, for about 8 years. And I spent most of my time there working in their innovation engine. And the role of the innovation engine was to develop new models of care. And mostly I focused on value-based models of primary care, something called virtual behavioral health, which today, if you heard that, you'd be like, why would you put virtual in front of it? Of course, most behavioral health is virtual. But in 2013, that was like a brand new idea, especially integrating it into primary care practices. And then worked on a few disease-specific models before I moved to our corporate strategy function to develop like long-term enterprise strategy for a large health system. And it was actually in my time when I was working in the innovation engine that I learned more about Clay Christensen and his theories of innovation that obviously aren't specific to healthcare, but have a lot to say about how we can improve healthcare and make it more affordable and more accessible. And I had an opportunity to go to Harvard Business School and learn from him and his teaching team, and then take those lessons back to Atrium Health and try to apply them in the new care models that we were developing. And anyway, after I'd moved on from the innovation engine to the strategy role, my prior boss, who used to lead the innovation engine but had since retired, sent me a posting for my now job at the Christensen Institute. And she said, "Hey, I think you should apply for this." But what she didn't tell me was that she was also going to apply for the job and then spend her interview telling them why they should hire me. So
Wow.
How funny is that, right?
You had an agent working for you to get you hired.
This is
Talk
true.
about the power of the network. I love that.
Power of the network. Also, she often calls herself a fairy godmother, which I think is probably fair. There was some bibbity bobbity boo going on there. But yeah, so that's kind of how I found the Institute and found this role. I wasn't looking for a new job, but when this came up and the original focus of research was something I was really passionate about, it seemed silly not to at least apply. So.
And what did your first day look like? I always think about people working in these think tanks. Like, do you walk in, they hand you a book, and they're like, just start reading, start ideating?
Oh, that's a good question. So I remember my first day, but the company's based in Boston and I live in Richmond, Virginia. So my first day was a lot of Zoom meetings, but mostly it was getting to know people. It was talking to my manager about the research project that I had to lead, and I don't know, like typical onboarding. Had a really long call with HR, but I'd say the thing that wasn't typical was everyone was nice. Like it's a small company and the culture is just really kind. And I think that was really clear from day one.
You know,
that's incredible.
Thinking about, we're dealing with people that are informing change and trying new things, and that niceness probably translates, tell me if I'm wrong, but it sounds like it translates into the type of psychological safety that's needed to try things that might fail.
Yeah, that's an interesting question. So I love Amy Edmondson's research on psychological safety, and I'd say, yeah, I think in a lot of ways it does. One, like, we're focused on innovation. So if you're not going to try and fail in a place that's focused on innovation, you're probably not going to get very far. So I'd say that there's probably some psychological safety baked in just based on like, what we work on. But I'd say also the trust that is clearly established across the team members. And I think that also says a lot for a company that's mostly remote, because it's hard to establish trust when you're only interacting every now and then. But so I'd say that's something about the culture that's pretty impeccable. It's clear that the head of the Institute, Ann Christensen, who is one of Clay's daughters, really trusts and empowers the people who work for her.
The job postings for this institute are going to go crazy after this podcast. Everyone's going to be, like...
Yeah, I don't think we have any open roles, but, when we do, maybe I'll just replay this and reshare it with people.
I think you should.
And maybe you become much more likely to get the job if you're taking one of those models and implementing them in your own systems, like you did.
Maybe so. Yeah, I think probably the fact that I didn't just know the theories, but I'd leveraged them on the ground, I think was, sure, helpful in the interviews, but also really helpful in the work.
So talk to us a little bit about the work. Like, what does good look like? What are the definitions of success? And how does the Institute want their models to like transcend or transform healthcare?
What an awesome question. That's such a good question. Actually, it was a lot of questions and they were all really good. But I think to tackle it first, I would say we do a few different types of work. And a lot of our focus is on research, and we focus on 3 different areas. So I lead our healthcare research. We also do research in education and then global prosperity. And so a lot of the focus is around the research, the identifying the innovators who are tackling seemingly intractable problems, and they're addressing them in new ways that can be leveraged by other innovators or social entrepreneurs seeking to do the same thing. And part of what differentiates our approach from that of other think tanks is we're really founded on theory. So we leverage the theories of disruptive innovation and jobs to be done and business models and more that Christensen came up with. And obviously he came up with them applied to...
Jobs to be done is originally from Christensen?
So that's a fun argument to have because not everybody agrees. But yes, we believe that it was co-founded by Clay Christensen and Bob Mesta. There are a lot of different flavors of jobs to be done in the market. I think that that's both great and confusing. So we use Clay and Bob's approach, but certainly other things can be leveraged from those who came after them and built upon the theory or expanded how you might think about a job or uncovering jobs.
Good to know. Spoiler alert for the fam. We're going to be going deep into jobs to be done and its application in healthcare. I read your paper not knowing that you were part of the founding institution. Keep going, but that just a quick little surprise for me.
Oh, yeah. I think that I won't get the year right, but he developed it with Bob Mesta, I think, fairly early in his HBS tenure, but that might be totally wrong. It's been around for a while, and if folks want to learn more about it on a granular level, the book Competing Against Luck that Clay wrote is a really great way to do that.
We could post that out. Yeah, Alyssa,
Yeah.
we will do that after the episode.
Awesome.
Yeah, we'll link to that for sure down in the comments. Down in the description too.
So
let's get.
go ahead.
Go ahead. Sorry.
No, you go ahead.
No, you. Okay, I'll go
You
ahead
go.
then. You win the niceness battle. So jobs to be done. Like I'm going back and forth with you on it, but what is that?
Yeah, great question. So its essence is it's a theory of consumer behavior. So I think jobs to be done brings a lot of value to really any market where you're using it, but especially in healthcare. So it's a tool to help you better understand your consumer or customer's behavior. And it's a way to uncover both how and why people make decisions. We say that jobs to be done have two parts: the circumstance or the situation that somebody finds themselves within, and then the outcomes or the progress that they're seeking. So jobs arise in our life every day, and we hire or fire products and services in order to get those jobs done. So in its essence, jobs to be done really points that people don't make impulse decisions about what to purchase. It's actually done to help them achieve a job to be done. So jobs is really powerful in that it extends beyond general demographic categories and individuals' characteristics. It's not about who you are. It's about why and how you made the decisions that you did, not just what you bought or your demographic characteristics.
Thank you for that definition, because like honestly, I worked at a startup. Let's call it about 7-8 years ago, and there was talk about jobs to be done, and there were some frameworks, but there was never that definitional conversation. So thanks for clearing out that perspective.
Sure.
It sounds a lot like necessity is the mother of invention in some ways, right? That things, an opportunity arises and people maybe rush in to fill that opportunity. But I don't know if I can I be controversial for a moment? Like a lot of times I think it's I always think of like the roles and those goals, and then, sometimes, the person who shows up to do that job really influences what that job looks like. And so how does jobs to be done handle big personalities or no personality?
Yeah, so I think that when you think about a job to be done, so the progress that somebody's seeking in their current situation, jobs are really made up of what we say like 3 different components. So they're functional, social, and emotional components to jobs to be done. It's not just like help me not be tired, right? That would be a functional outcome. It's also like, help me feel good about what I hired not to be tired. Or help me, that would be the emotional component, help me be perceived as a healthy person because I hired coffee and not a 5-hour energy, something like that. So it's really about, jobs to be done is really about the causal mechanisms that lead people to make decisions, as opposed to you made this decision because you're a white female somewhere between the ages of 30 and 40, right?
Okay, so stepping outside of, what does the demographics and your data of who you are and how you buy should happen?
Right. Yeah, because demographics don't tell you why people behave the way that they do. One of my favorite examples, which doesn't land quite as well now, but it's if you're, a British citizen and you're a male and you're famous and you're in your mid-60s, you're going to behave a certain way. But who are two famous people, one may have recently passed away, who may match that demographic?
Ozzy Osbourne?
That's one.
I was going to say Queen Elizabeth, but she's not male.
Close. Think of a relative. Well, it used to be Prince Charles, but now he's King Charles, right? So, right, those two individuals may have similar, age groups, demographics, nationalities, but who they are doesn't mean they're going to make any of the same purchasing decisions, right?
Right.
But, and Chris and I don't fall into many demographic overlapping areas, but we might decide to buy the same things because we're seeking the same outcomes and we have the same struggling moment. So another key component of jobs to be done is uncovering the moments where people are struggling and identifying what did they decide to do to eliminate or overcome that struggle.
Melissa, I think that this goes right into a theme that you consistently bring up, which is understanding, when we're thinking about our fam out there building innovations, trying to sell it into health plans, et cetera, or working within institutions and having different things that types of progress they want to make. It's not a matter of getting a bunch of features and putting that into the air and trying to impress people with that. It's really understanding what are the causal mechanisms, what are the fires that they're really focused on, and then positioning their strategy and their communication with those individuals in a way that solves those jobs to be done, rather than just imposing hey, I have the best and greatest thing out there, please go with me.
And because I like it and I think I know what you want, you should like it too.
Mm-hmm.
Right.
Are we on the right street?
Yeah, you're on the right street, because when I worked in innovation, I saw so many pitches to the health system to try and buy their shiny thing, right? But to Melissa's point, they talked about why they thought it was cool and why they built it and what their job to be done was in creating this company or creating this product. And it was just a total miss for understanding what the job to be done at the health system was in looking for this product to fill out their product suite, and sometimes a total miss on even what the patient needed from interacting with their product.
So for the fam, we're talking at this theoretical level and all that, but that's not where we stop on this show. There is a jobs to be done framework about one of the hardest challenges that we can think of, and how it applies to parenting, providers, and policy, about getting children to engage in healthier behaviors from multiple perspectives. And we can deep dive on that. Love that example. And that's another, what was that paper called, Ann Somers?
Less Sugar, More Life. It had a subhead, I can't remember. But
it doesn't need a subhead after that. That's a good title. So we want to drop that for folks to follow along with. But what do we think about? We'll do a deep dive on that, and as we're going through it, which is a powerful use case already. Especially, it's threading a needle that a lot of people in our audience are interested in, and we want to invite our fam to think about how jobs to be done can apply in their own innovation and their own pursuits. How does that sound?
Awesome.
I love it.
Sweet. So what's the 20,000 foot view, high level on that paper, sugary beverages / jobs to be done framework?
I'm not going to bring my drink into the framework. Guys, if you saw this, bam, it is like the largest Diet Coke that is possible. And it just showed up because I DoorDashed it to my house. So now I feel shameful as we go through this conversation.
Yeah, you're pushing us back.
My boss
Totally.
loves Diet Coke. If it makes you feel any better, she loves it. So the 20,000 foot view is people don't stop drinking sugary drinks for the reasons you think they do. And I say that because in healthcare, when providers are seeking to help their patients make behavior change, they often focus on the outcome that is important to the provider or that they think is important to the patient in front of them. But jobs to be done helps uncover, again, the places where people are struggling and the outcomes that they're really looking to achieve. And when you understand where people struggle and what they really want out of a change, you can use their language to help others in the same circumstance make the decision you want them to change. So
Ann Somers, we've used this all the time in my background, but we didn't call it jobs to be done or based on this paper. But everyone talks about like, oh, we had thought here at the health plan that, you know, people just want to be healthier. And when their physician tells them to be healthier, they're going to be healthier. But actually what you have to understand is their reason to be healthier is because they want to play with their grandkids, right?
Yeah,
and
exactly.
not, you know, or, you know, their tennis game is suffering. So they're going to, you know, put down the Diet Coke. My
Right.
tennis game is fine, and I am not giving up my Diet Coke. Diet Coke, call me. I'm your biggest fan. Nonetheless.
But yeah, that's basically it, right? People don't want more health, people want more life. Health is a means to an end. Being healthy helps me live more of my life, whatever that is, playing with my grandkids, playing tennis, etc. And what we uncovered when we talked to parents about why they had decided to fire sugary drinks for their kids, and maybe just pausing there for a second, the reason we cared about this is kids consume too much sugar in the United States. It's non-nutritive, it's highly caloric, and that leads to chronic conditions. It leads to obesity, it leads to heart issues. Your listeners know all these things. But the reason that we studied it is to understand how can pediatricians and other practitioners, how can public health advocates, and how can policymakers actually help people make healthier decisions. So we talked to parents who had said, I'm finished giving my kids sugary drinks. And we uncovered 5 jobs to be done. So 5 different situations, 5 different outcomes that led parents to say, we're done with soda, or we're done with the sugary juice. And what was so powerful in that was a few things. One, all the messaging around like, don't drink sugar, you're gonna get cavities. Doesn't matter. Doesn't matter. Because parents think that cavities are fixable. And cavities might be something that kind of raise a flag to parents about, hey, you might want to change some behavior here, but it's never the last straw. It's never the final thing that makes them say, we're done. So it's an early indicator, but it doesn't get them over the hump. So cavities aren't it. The other thing that was kind of a surprising finding was price. We usually think that sugary drinks are less expensive, and in a lot of situations they are. They're purchased because they're the less expensive option. But some parents said that they were surprised to find, like for example at Walmart, that their flavored water was less expensive than buying like sugary soda. So that was, I didn't expect that. But we could also dive into like the specific jobs to be done and what people did in specific circumstances, but I think that's the 20,000 foot view.
I like that overall perspective, and you know, there's a depth to what you're discussing, both you and Melissa, on like understanding it in a level that moves beyond features, and to what people are actually trying to accomplish, or what might even be motivating them subconsciously. I'm curious about how you arrived. Like you said, there was conversations with parents and things like that. How did you arrive and validate what these jobs were?
Great question. So another thing that I really love about Jobs to be Done that sets it apart from other research methods is it doesn't ask people about what they would do in the future. It asks them about what they did. It asks them about behavior they have already engaged in. Because as humans, we are really good at forecasting our aspirational selves or our ideal selves. And when asked about our future behavior, we think through the lens of what would ideal me do. Not because we're deceptive or because we're bad, just because that's how our brains work. But because we're projecting what our ideal selves would do, asking people about their future behavior isn't really a good indicator of what they're going to do in the future. Instead, you should ask people about what they've already done, because the past is often a good predictor of the future. And only by explaining what they have done can you really get at the struggle and the desired outcome. So that's one thing that I would say is really important. But in our interviews, we effectively take the view of, hey, Chris, I want to film a documentary about your life, about how you decided that you weren't going to drink sugary beverages anymore. So I want you to tell me about all the details surrounding the decision, like who you were with, what you were thinking, what you did, where you went. You can think about it like I'm trying to film a documentary of your life, which might sound a little weird, but the good thing about this is it's your story. There are no wrong answers. I just want to hear the story through your experience. So it's really an effort in understanding the individual's story so that you can really get into the details of where they struggled, what their motivations were, what were the trade-offs that they made or the ones that they considered in order to understand why they hired what they did or why they fired what they did.
So it makes me wonder. I love like that deep conversation with these individuals as our innovators are thinking about how to understand their markets and things like that. What kinds of numbers should they be thinking about in terms of how many of these conversations to have and how to think about that?
That was such a data scientist question.
Get me out of here.
No, it's a really good data scientist question because it's a tactical question about how do I actually do this. So with jobs interviews, you don't need hundreds. You don't even need 50. You need like 10 to 15. And you know you've done enough when you stop hearing new things. Like when you stop hearing new struggling moments or new desired outcomes. So for this body of work, we did 15. And by about the 12th, my interviewing partner and I could peg about 20 minutes into the interview which job the person fell into. Because the stories were so aligned, the struggles were so similar, the desired progress was really clear. So you don't need a lot.
It just makes me think that there's a room of data scientists somewhere that are racking their brains over all these different data sources and stuff like that, and not asking the question, well, how do we get out and actually talk to the people that we want to build for?
Yeah. So who do you talk to? How do you find them?
We know, Chris. We ask all the time. We ask all the time. Like, what motivated that moment? We love that part. We like the guts of that, like, activation or non-activation moment.
Yeah.
Right? You really interrogate the data. You probably pick up more data sources than 15 usually, though.
A little bit, depending on the scenario. Yeah. But, you know, we got cold start, got to start somewhere.
And sometimes the challenge with data is it doesn't always tell a story, and that's why talking to people is so powerful. Because people, when prompted correctly, can tell you a really powerful story about their lives and how they decided to do what they did. And we used an online platform called Respondent. So with our funding partner, we were pretty clear about the population that we wanted to learn from. And so we used some demographic filters on this platform to say, give me people in these states who meet these criteria and who have made a decision to stop giving their kids sugary beverages. And kids was defined as people between kindergarten and 5th grade, because above that, the kid's making the decision. But we wanted the situation where the parent was deciding. So kids between K and grade 5 and who've decided in the last 3 months that they're finished with sugary beverages. And the reason the last 3 months was important is people will remember big shifts over the past like 90 days, or really will remember decision-making processes over the last 90 days. But when you get further out than that, sometimes it gets kind of spotty on people's memories.
Quick question too, because somebody listening to this, they're going to get hyped up listening to you talk about it. But what if they jump out and they ask the wrong questions or come to the wrong conclusions or define jobs in the wrong way? Are there some guides that the Institute makes available, or what are some ways to make sure that I'm defining jobs in a way that actually makes sense? Like, what can I use as my litmus test?
Yeah, so we do put out we put out all of our work on Jobs to Be Done, and on our website you can learn more about what it is, and we can do trainings for organizations if they want to learn how to do Jobs to Be Done themselves. I'm giving like a really high level overview, but I wouldn't suggest that anybody listen to this podcast and then go do Jobs to Be Done interviews, because the analysis,
there goes my afternoon.
the analysis on the back end is actually for very qualitative research. The analysis on the back end is very quantitative. So in order to do an end-to-end job study, you do need to be trained in how to do it. But some great resources if you want to learn more about it. Bob Mesta's consulting company, The Rewired Group, is a really good one. You can go to their website and find a lot of resources, but you can also subscribe to their newsletter, and they send out very practical tips about using Jobs to Be Done in your work, and I'd say common pitfalls and how to avoid them. So he's another really good one to follow.
Ann Somers, with the emergence of AI exploding everywhere, is AI shifting how Jobs to Be Done is applied? How is that shifting your landscape?
When you mean AI, like, are people going to AI to ask questions that they previously would have gone to their customers to ask? Is that what you're saying?
Well, yes, that's definitely true. I just wondered, you just talked about this incredible approach, and I was thinking, oh, well, have you all thought about applying AI to this concept, or is it not possible to do that, right? I mean, you could have the AI Ann Somers agent, asking these interviews.
Yes. So I do actually know Jobs to Be Done practitioners who have used AI to hypothesize jobs to be done, and they've used that as a jumping off point for their research. So whereas before they would have started with more of a blank slate, now they're going to AI and giving really detailed prompts and getting back some hypothesized jobs to be done. I don't know that that's especially valuable, because at least to this point, ChatGPT, or pick your favorite AI platform, is guessing based on the data it's been trained on, and it has not been trained on the human stories that you're trying to uncover about whatever hiring or firing decision you're looking for. So yeah, AI could probably be useful in helping you hypothesize some jobs to be done, but you can't skip the step where you actually go and talk to the people and hear their stories, because AI doesn't have that yet.
Yeah, practically speaking, like if we asked ChatGPT, hi, why are you wearing Audio-Technica ATH M50X headphones? It wouldn't be able to give that answer. Like, it could speculate as far as like, well, it has a larger driver radius, etc. But the reason Melissa's wearing it is because I was like, hey, these are the headphones you need just to get like this is what's up. And you don't, without the actual stories from people, you just don't have access to that represented in these models.
That's a great example.
Yeah.
It would probably over rotate on the functional aspect of the job to be done, and under emphasize the emotional and social component, which I will say in health and healthcare are often far more important than the functional outcome.
And if Ann Somers had asked me, Melissa, why did you buy those headphones? I would have said, because I was doing about 85 things at once. And I looked at Chris and I said, here is this very experienced podcaster. He's going to be a much better selector at the technology than Melissa would. And I just deferred my decision to Chris. I was absolutely influenced.
Nice.
So, there is. Tell me if people are using this use case, but I think there's a potential interesting AI use case in how people develop digital twins, which for the fam, that is using these mechanisms and models to identify ways to represent the types of decisions that people might make by a given persona or by a given demographics. It seems like they're like the insights gathered from these deep conversations would be able to help create much better personas that organizations could model behaviors and test scenarios and run simulations with. Has it been used, or are you aware of it being used in that context?
I don't know. That's a great question. I do think that pairing them together would certainly create something really powerful. When I was at Atrium Health, pre-AI days, I mean, not pre-AI, but you know what I mean, pre-generative AI, where you're using it in your workflow, we would pair jobs to be done with personas. And it makes for a much stronger persona, because generally personas are just based on demographics, and that's antithetical to the jobs to be done approach. You don't buy something because of who you are. You buy something because of why you're struggling and what you're trying to achieve.
And how it makes you feel, or how you perceive it will make you feel.
Or how others will perceive you. Yeah, exactly.
Mm-hmm.
Well,
I hope everyone perceives me amazingly in these really amazing headphones.
You look very professional, I will say.
Or without them too. All of the above, Melissa. Come on now. Straight up. I have an excuse to explore down that pathway. So give it a couple of months. I'll report back to you. I'll shoot, if you have a little time available, I'll hit you up for guidance on that. But that seems like an interesting path to pursue. Let's get back to the sugary beverages use case. Like, we've explored like the formation of jobs to be done, but gosh, to see parents, providers, and policy like all in the same place and things like that. Like we're discovering jobs to be done, but how do we actually make this applicable and come up with these recommendations that are in your paper?
Yeah, for sure. So maybe just really quickly, I'll highlight what the 5 jobs to be done were that we uncovered to help people kind of ground themselves in what we're talking about. So the first one was parents or caregivers who had already made a healthy change for themselves. They had decided they weren't going to drink sugary drinks or sugary foods, but they hadn't yet done that for their kids. So they felt guilty. And we summarized this job as help me prioritize my kids' long-term health like I'm prioritizing mine. So these parents felt badly that they had made a decision to prioritize their own health for the long term, but they were still letting their kids eat and drink sugary things because it was easy. So
I have another question on that one.
Yeah.
I mean, that seems kind of counterintuitive that they would, put their seatbelt on before reaching out to put their child's seatbelt on. Was there something that drove their own behavior?
Yes.
Did that come up in the research?
Usually it was like a family health issue. So they were fearing for their own future health because like a parent had had a stroke or a parent had had a heart attack or like a really negative health outcome that they wanted to avoid. And because they had current health struggles, like they were overweight or had some sort of biomarker that was out of range, it felt more imminent for them to do first.
Worse than the cavity. Makes total sense.
Yeah, but that's a good question. The second job to be done had nothing to do with health or healthcare. It was help me fix my child's disruptive behavior. So people who had this job to be done noticed that when they gave their kids sugary drinks, they had a range of behaviors that the parent didn't like. So they were either disruptive, they were bouncing off the walls, they were aggressive, they weren't listening, or the opposite, they were depressed, they didn't want to play sports, they just wanted to sit around. So it was a negative behavior the parent wanted to get rid of. It wasn't about health, it was really about the behavior. Like, help me fix the behavior now. The third job was really about guilt. It was help me feel like a better parent. So these parents had kids who had health issues that were the result of dietary choices. So the parent felt guilty because they'd been giving the kid sugary drinks and less nutritive foods, and therefore the kid went in for a well child visit and had an issue pop up that was tied to diet. So these parents felt really guilty and wanted to make a change, and an easy one was getting rid of the sugary drinks.
Ann Somers, how does income play into that? I work with a food as medicine company, right? And so oftentimes we see people who want to make some of these changes, does income come into play in this?
Excellent question. So actually, everybody we interviewed was poverty level or below. So we specifically focused on low income populations because sugar sweetened beverage consumption is higher in Black and Hispanic lower income populations than it is in middle or higher income and white counterparts. So we focused on the group that had the greatest amount of struggle with sugar sweetened beverage consumption. But yes, it still comes into play. And one of the things that we heard in our interviews was the importance of SNAP benefits, or SNAP and WIC for some of our interviewees, not all, but for some of our interviewees, they did mention that and how it afforded them the ability to buy healthier options.
Yeah, I love that. Chris, this goes back to our Emily Brown episode.
Yes.
Right?
Yeah. Better health is attainable.
Yeah.
Love that.
So the fourth job was help me cut down on sodas for my child's long-term health. These parents were specifically struggling with their child's weight and associated health issues, and they were worried about their children exhibiting addictive behaviors with sodas. So they wanted to cut down on sodas for their kids, both for the health benefit, but also because they were worried about addiction down the line. So some of these parents thought, like, yikes, my kid is drinking soda after soda after soda. Today it's soda. What's it going to be 5 years from now? So they wanted to curb the behavior now. And then the fifth job to be done was help me build healthy habits for my vulnerable child. And parents with this job to be done had a child with a vulnerability, like they had extreme allergies, or they were born very prematurely, and they had to be really careful with the kids' food and beverage consumption. And a big part of this job to be done was to help the parent with their own health habits, because the child mimicked the parent, and the parent knew they needed to clean up their act so that the child would have healthier examples to follow.
This takes the conversation and the thinking, policy recommendations, all that so much deeper than issue a report about cavities and downstream health and hope for the best. Like it's just so much deeper and so much more going on to that when we think about this problem.
Yeah, for sure. And so to your question about like what do pediatricians and public health advocates and policymakers actually do about this, I'll be the first to acknowledge pediatricians don't need more to do. I'm not trying to give providers or clinicians more to do in the limited amount of time that they have. It's really, our recommendations are really about how they can leverage the insights we discovered from our research about why parents quit sugary drinks for their kids, so they can help other parents in similar moments of struggle. So from an overarching perspective, we really suggest that pediatricians leverage the trust parents have in them and the trust that they place in them at that point of care when they're visiting the pediatrician and maybe discussing a problem or at a well visit. And the first recommendation is really just to listen for indicators that the parent's current struggle with their child might be associated with sugary beverages. So it could be health related, it could be behavior related, it could be something else, right? One of those 5 jobs to be done. And then if the parent is struggling with the child's sugar sweetened beverage consumption, the provider can try to determine, based on the struggles the parent is mentioning, which of the 5 jobs to be done the parent might fall into. And then they can speak to the moments of struggle and the specific desired outcomes. Because let's say a parent in front of you has a job to be done around disruptive behavior, talking to them about helping your kid avoid diabetes down the line, that's not going to land with them, right? Because that's not their desired outcome. So our recommendations are really around how can they listen and what to listen for in order to tailor the advice that's going to have the most successful outcome to curb drinking sugary drinks.
Have there been campaigns or outreach to these physicians or to parents, et cetera, policymakers? Could you talk about some of the resulting efforts from that work?
Yeah, so we did meet with one large health system who was interested in how it could support their community benefit and social impact work. And then I had a conversation with the American Association of Family Physicians who is interested in how it might tie into their public health efforts. But I will also say, if there are listeners to your podcast who are either practicing pediatricians or leading health systems where you're struggling with similar issues with your population, I'd be happy to chat with you.
Yeah, I think a lot of the product owners deep in many of the payers and health systems that are working on this could really benefit from this approach. When I think about a lot of the product methodologies I deployed in different spaces, there's flavors of this, like person-centered design, listening interviews. But I really like some of these academic constructs that kind of, I'm going to simplify it to say, create these 5 jobs. I'm probably not using all your language in the right way, but
that's right.
These are very much like almost like personas on steroids that can be leveraged, and then say, okay, let's now stratify our high cost claimants into these 5 different jobs and say, how should we be reaching them differently through our targeting campaigns?
Yeah.
I think it gives a very practical approach to a really challenging problem.
Awesome. I'm glad to hear that. I'm glad to hear it lands.
Yeah, well, it lands with us, but I'm thinking that, Melissa, you brought up a friend of ours in the food as medicine space. I'm thinking about, so as one of my partners, fellows in the NYU McSilver Institute for Poverty Policy Research, she actually leads food and healthy eating programs in New York City. And I'm just thinking of all the people that are doing work out here that can listen to something like this, read that report, and without having to do all the interviews and things like that you have to do, steal from that knowledge.
Yes,
and,
please take it.
Yeah.
Take it and use it. That's the goal of the research, is for people to take it and use it. So yes, definitely invite that.
Well, and I think there's a second level too, is to say, okay, what did Ann Somers and her team learn, and then how does our specific product have these different nuances which potentially impact those jobs? I mean, it just goes back to those moments, Chris, that we talk about. Always think about those moments of activation, right? We are so not as much in control, or maybe there's other psychological forces behind why do we act the way that we do. And why do we suddenly make a change? And I know we have so many people struggling with, as the world changes, should I be making this change? As more algorithms get more addicting and the sugary foods get better tasting, right? It's a lot harder to defend against some of the things that aren't that great for us.
Oh, absolutely. And I think that's actually a perfect segue into what our public health recommendations were. So our provider recommendations really focused on how do you address the need for change at the individual level. But I want to be really clear that we are not suggesting this is an individual level problem. In order to curb sugar sweetened beverage consumption, we need a food environment that doesn't make it so easy and ubiquitous to purchase it, drink it, have it all the time. So our public health recommendations really focused on how to ignite change at the systemic level. And the first step is acknowledging that the food system in the US doesn't support making healthy choices the default choice, because nutritious food is neither easily accessible or widely affordable. So the systemic barriers to improved health, including the policies that support corporations to continue offering these inexpensive, non-nutritive beverages to children and, quite frankly, to adults, have to be addressed. So yes, we can ignite change at the individual level, but without systemic change and creation of a food system that makes more nutritious food and drinks accessible and affordable to all, we won't get far at all. You'll just help people make slightly more optimal decisions in an extremely suboptimal environment.
Yeah, it takes a lot. It takes a lot to fight against a suboptimal environment and make the right decisions for yourself. We should make it as easy and affordable as possible to do the right thing. It does make me wonder too, because in the past we've advocated for our our followers to submit RFPs to CMS and things like that. Just wondering about anything that you would encourage people to lean on, weigh on, or speak to to help nudge policy in the right direction.
I love that question. Your voice matters. Call your congressman or congresswoman petition for what you care about. Don't think that just because you're one person, your voice doesn't matter. Like calls, letters, showing up in their office, all of those things matter. And vote, because voting counts. Every vote counts, so make sure you vote. If you care about these things, make sure you vote. I do think that when you were saying, like, you were encouraging people to respond to the RFPs from CMS, I know it's not my podcast, but I'd love to ask y'all a question about what you think about in terms of like improving the health environment and the role of wearables. Because I thought I mean, just transparently, my perspective, not the Institute's perspective, but I just thought that's not going to help anything. Like giving people a wearable that says, hey, when you eat this non-nutritive, inexpensive food, it spikes your blood glucose. Like, but then they can't do anything about it because if they can't afford a better food, I don't know. I'm just like, where does that really get us? So I'd love to know what you were encouraging your listeners to like put forth or propose.
So as far as wearables and all that, I personally don't see wearables as a panacea. I have an Apple Watch, but where is it? I don't even know. Like I want a world where the data from wearables and things like that are applicable and used in the right scenarios and all that. I'm not really like in the specific advocacy. It wasn't specifically about, hey, go tell CMS that we need legislation around wearables. Now, I do want innovation, like for healthcare, for healthcare innovators and health tech innovators to have more transparency from the government as far as like, let's talk about like what the FDA might be expecting, or what kind or more abilities around things like interoperability. Like I like things like that.
Yeah.
But the wearable stuff, I've talked to some physicians that are really gung ho about wearables, and like it's really moved forward since 2015. But to say that is a panacea and that's the solution to the problem, I got a wearable and I just don't wear it. Like I'm the horse at the water that's not drinking.
So I will take the counterpoint on that, because you can't see it, but I'm actually powered up twice. So I'm on the Apple Watch, and then I hide my Whoop up higher on my arm because I love my Whoop so much. I sleep in it, right? I have not gotten into the Oura Ring. My husband makes fun of me all the time. He's like, please do not wear that out in public. You look ridiculous. But I have found it to be incredibly helpful, because I deal with some autoimmune things, to like actually understand how different pieces of my behavior are actions. And the biggest thing that has changed for me in the wearing the Whoop, not so much the Apple Watch. The Apple Watch, I just like to get my phone faster. That's why I wear the Apple Watch. But the Whoop, it helps my sleep. I feel like I am way better. I'm more sleep consistent. I'm really trying. I used to be like a night owl. I'd go to bed at 2. I'd be up at 6. I'm like, yes, I'm a warrior. I'm getting things done. Now I'm like, I feel so much better with sleep. I love sleeping, right? And so now I'm like, oh, could I go to bed at 9 and get up at 4:30? This is so great. So I'm just enjoying the wearable for like what it can teach me. And then if I go back to like my academic type work, so when I was at United, I was tangential, I think, to the group that was doing the CGMs, the continuous glucose monitoring. And one of the big things that came out of the diabetes prevention program was this idea that if you have to eat something sugary, then the behavior you should take after the sugary thing is a walk. Right? And so we were really trying to align, a healthy behavior with an unhealthy behavior.
So it sounds like I need to rethink my relationship with wearables, because my sleep patterns are pretty terrible sometimes.
But hold on. So that was actually just an excellent example of jobs to be done. You hire the wearable, Chris, you don't. And it's because you have different jobs to be done. And maybe that's what I didn't realize was rubbing me the wrong way about this. Like, we're going to give everybody a wearable and that's going to fix all the things, because it doesn't take into account anybody's differing circumstances or desired outcomes.
And I think a wearable can give you a lens into jobs to be done, because it's a different set of data that shows potentially different behaviors. Like in my Whoop, I'm actually tracking, if I feel bad, what are some of the things that are driving the feel bad or the feel good? Like the days I do sauna, weirdly, I feel better than the days I don't do sauna. I mean, it's like these normal things, but you know, until you, like, if you're an analytical person and you get to see all your data, you're like, well, you know, if I want to keep feeling optimal, I should be sauning. Otherwise, I'm just going to feel bad.
There's also the fact, too, just because I don't personally use wearables doesn't mean that, like, if I'm thinking from a policy perspective, I would advocate against well, I don't use that, so nah.
I'm going to shame you until you start wearing it again. No, people can wear whatever they want or not. It's fine. It's up to them. But I think it goes to, it's so individualized right now, right? And I think all of us on this podcast, I'm hearing us say, like, we want people to be healthier and improve, right? And we want to understand maybe what drives the healthy and unhealthy behavior so we can start to help make that systemic change. That's the stuff I'm really excited about.
That's a really good summary. I would agree with that.
And yeah, it would be interesting to look at what is blocking the adoption of wearables from the from the medical perspective, and think about what can help overcome those barriers. Because, like, when we're thinking from a jobs to be done perspective, if the data from the wearables was presented as some separate app that these already overstacked and overburdened providers are having to interact with, then that just completely eliminates the chance that it can be integrated into a workflow. But yeah, there's probably a lot of JTBD perspective that needs to go into that to help with the policy recommendation.
WWJTBD. What would jobs to be done do? Maybe we can make that movement happen. It'd be great.
Well,
Chris, can we play the game with Ann? Can we play the game with Ann Somers?
I was about to transition. Yeah.
Can we do?
But that's you. That's you now.
Oh no, you're the best transitioner. Okay, so Ann Somers, every week at the end of our podcast, we do our favorite, well, my favorite segment, which is pop culture, right? So, is there anything? It could be something you're listening to, something you're reading, something you're watching that might relate back to hope, power, and healthcare in any way, shape, and form. And if you haven't listened too much before or made it all the way to the end, you do not have to be academic on this section. You know, I've talked about the summer I turned pretty. We talk about the WWE. It could be anything that, you know, gives you hope or reminds you of healthcare.
I talked about Buc-ee's last week, and now I'm sporting an Alabama. I'm from Alabama, and I got my Buc-ee's cup. So it can. But
did Buc-ee's send that to you? Shout out to Buc-ee's.
But I've talked about opera before too. Like, it can be whatever.
Okay, good.
Chris, you go first and let Ann Somers think.
Dang, I was going to use that time to formulate my own answer.
It's okay. I can go if you want to think. I can
Go ahead.
I'm really glad that it's not actual pop culture, because I am really bad at pop culture. So, some things that I've been listening to that I think are relevant to healthcare. I really like the podcast Raising Good Humans. So it's Dr. Eliza Pressman, if people don't listen to her and you have children of any age, or really, even if you don't, it's still a really good listen. She's a child psychiatrist or psychologist. Sorry, I'm not sure which one. But she's a really good listen and has awesome people on her podcast. And then the second one, I'm about a quarter of the way through a book that my primary care physician actually suggested I listen to, which is The Myth of Normal. It was a New York Times best-selling book. It's from 2022. But anyway, it's this physician he's a Canadian physician, and he wrote the book, and it's about like the mind-body connection and some things that we tend to underweight in Western medicine, not in like a woo-woo wellness kind of way, but in like an evidence-based kind of mind-body connection way, which, so it's interesting so far.
That's
Good,
awesome.
yeah.
You nailed it.
Me or you, Melissa?
Oh, you are up next, Chris.
Okay. Well, gosh, I don't know that there's much of a healthcare relationship with mine, but anybody, I don't know, who's an LCD sound system fan around here? Daft Punk is playing in my house. Well, they're one of my favorite bands, and Shay, my partner, and I we're going to go out and see them on Thursday night. Been listening to them for over a decade. It's kind of this like synth punk type music. Anybody looking on in the background can probably see a bunch of synthesizers in my background. That's partially inspired by LCD sound system, and I don't know. I just think it's great music to listen to, and really fun. So looking forward to actually seeing them in person in Detroit in a couple of days.
I love it. I put it on the make sure that you put it up on the playlist for
Will do.
the fam. That would
Will
be wonderful.
do.
Okay, and once again, I will just bring down the IQ average on the podcast because I am back into another documentary.
Yes.
And this time it is the true reality story of The Biggest Loser. So I was obsessed with The Biggest Loser when it came out. I was like, I would cry. I would be cheering for people when they were like weighing in. And now we're seeing all the behind the scenes. And now you've got Bob Harper and Jillian going at each other, releasing text messages over the time on The Biggest Loser, with Jillian alleging that Bob Harper knew that they were giving like diet pills and caffeine pills to The Biggest Loser folks. So,
Oh, wow.
So y'all, I am here for the drama, and I'm going like, how did something that brought me so much joy was so bad?
I didn't realize that.
Yeah, lots of, sugary beverages were probably drank before and after that show was made.
Well, I gotta say, speaking of that, like, y'all don't know this. I used to be 240 pounds. And
Chris.
Yeah, 100. And I got really deep into running. Let's call that 2015, ran first marathon. No, second, 2014 first. But like one day I was driving around in my hometown, Mobile. It's probably like 2017 or so. And I saw this, there was a big half marathon going, and somebody told me it was like The Biggest Loser half marathon. And like, I kind of like, I'm sitting blocked in traffic, but kind of crying because like, I was just thinking about my experience and like how they had come so far to be able to run that half marathon. So to hear that, that not all those people are faking, they're out there running a half marathon.
Yeah.
So I'm glad that I'm glad there's that part of it, but it is sad to hear about some of those shady underpinnings, which
Yeah, they needed jobs to be done, and then they just needed to do it in a safer way.
Yes.
It would have been okay. Well, Chris, thank you for sharing that story with us. We will come back to this. Yeah.
Yeah. Open book over here.
Aw.
Y'all. Oh, Ann Somers. How do people follow you? Like, what are you putting out there that people should be consuming?
LinkedIn. They can follow me on LinkedIn. And I recently released a Substack called Healing Healthcare. So they can follow that too.
Aw.
Fabulous.
We'll
Thank
post
you.
this up.
Yeah. The energy and excitement that you saw today was not
Manufactured.
in any way caffeinated. Like, this was all you, Ann. Really thankful.
No,
Really
thank you
thankful.
guys for having me. This was a really fun conversation.
Yeah, it was incredible. Yeah, it was a gift. So thank you. And I'm excited to see how our fam is going to apply these frameworks to their innovations or to their life decisions. That might be even more interesting to hear those stories.
Yeah,
Indeed.
It is not just the corporate world for this stuff.
For sure not.
All right, thank you. And we'll see y'all next time. Thank you so much.